Where will the most exciting and useful health discoveries be coming from in coming years? Now, these are the sorts of conversations I entertain in my new book, Undoctored: Why Healthcare Has Failed You and How You Can Become Smarter Than Your Doctor. So where will all the most exciting and useful practical tools for health be coming from? The drug industry? The medical device industry? Multinational corporations? The US government? I predict we're in a new age where there are new rules being applied and new tools available to us. One of the most exciting things we have available to us now are tracking tools for health. For instance, a mathematician in Boston recorded the voices of thousands of people with Parkinsonism, various degrees of severity of Parkinsonism, as well as people without Parkinsonism. He developed a mathematical algorithm that allows voice recognition to diagnose Parkinson's disease. And it's more accurate, more precise than an MRI. And it's virtually done at almost no cost as compared to the many thousands of dollars of an MRI coupled with the toxic effects of the gadolinium dye they use to obtain the images. Even better, this software analysis is also quantitative. MRIs are not quantitative, they're crudely qualitative. Good, bad, in between. The voice recognition is quantitative. Well, this inexpensive tool, what if it were made available to the thousands of people with Parkinsonism? They have now a means to track progression or regression of their disease, or at least stabilization. Imagine what that means. Put this measuring, tracking tool in the hands of thousands of people with the condition. They're not going to explore new drugs or new procedures on the brain. They're going to explore simple, natural, accessible things, like maybe nutritional supplements or some kind of new health practice. What will happen, I predict, is someone will accidentally, fortuitously observe in Galveston, Texas, that doing X slowed the disease down, maybe even caused it to reverse. Maybe some combination of supplements or some other combination of strategies. He reports this in some collaborative online discussion. Somebody in San Francisco says, that's interesting, I'm going to try it. He or she tries it, sees the same effect. He or she shares that experience. Someone in New York tries it. And then a bunch of people collaborate online. They say, let's try it with 100 people. Here's what we're going to do. And we all collaborate and report our experience over whatever, 3 months, whatever time period required, depending on the condition you're talking about. Think where that could lead us. Multiplied by thousands and thousands of times, thousands, hundreds of thousands, maybe millions of people. We're going to be flooded with incredible solutions. We'll also learn what doesn't work, right? But that's okay. That's part of the learning process, the process of exploring our health for answers. But think of the answers we'll get. We'll get answers like these 2 supplements reverse this condition or slow it down. Not some drug at $3,000 a month that requires an injection and all kinds of out-of-pocket costs in addition to the insurance burden, or some implantable device at tens or hundreds of thousands of dollars to benefit the healthcare system and may work, probably doesn't. So think of it. We're in this exciting new time where the answers in health will be coming from people like you and me because we collaborate. We're going to have access to new tools to identify and track various conditions. And the answers will be inexpensive, accessible, safe, and we can prove whether they are effective or not. That is the future of health, the kind of health I call undoctored.